vodka samples up here. Okay, good afternoon. Everyone is here. We have a great crowd for this event. My name is Steve Tamplin. I'm an associate scientist with the Institute for Global Tobacco Control and substituting for our director, Dr. Joanna Cohen, who can't be here today. It has nothing to do with the fact that Ryan is speaking. As you probably know, this is one of a series of lectures, seminars that we support through funding from Bloomberg Philanthropies on tobacco control research. I would just start off by saying that our research is very much applied oriented and we do lots of work in developing countries, low and middle income countries, and have lots of in-country partners. And you'll hear something about that as Ryan speaks to us later. Actually, introducing Ryan is quite a challenge. So I had to go on the internet with my virtual reality glasses. And you can find some interesting things there. What I found was this bio of Ryan that said, Ryan left his suburban Toronto reality to be trained as a cage fighter in the Australian outback. After a season on the circuit of underground and after-hours work, he escaped to a wildlife refuge, nursing orphaned wombats back to health. He became disillusioned, however, by the marsupial activist community, and then migrated to the northern interior of British Columbia, where he opened a yarn knitting paraphernalia retail outlet. Unfortunately, he was just ahead of the knitting revival, and bankruptcy quickly followed. Then there's some stuff about hitchhiking through Canada and reality shows and things like that. But I digress. So back to reality. The most important thing to remember about Ryan is his wife's name, which is Simone. His wife is an engineer, so she keeps him technically correct. He has two sons, Cedar and Hudson, referred to euphemistically as Huddy, I believe. Yeah. And this is true. After abandoning cage fighting, Ryan is now, I believe, a certified member of the Broomstones Curling Club, which is located in the Boston area and is reputed to be the largest curling club, perhaps the only curling club on the East Coast. In any case, back to his formal training. Ryan was trained in environmental studies, ecology, social marketing, and health psychology. He'll work all of that into his presentation as we go along. He has a PhD from the University of Waterloo, where he worked very closely with Dr. Jeffrey Fong. He spent some postdoc, you have to, I'm not sure what the meaning of that really is. Postdoc.
It's postmodern, I think.
Postmodern, okay. Yeah. He was at Harvard School of Public Health for a few years and worked with Dr. Greg Connolly. He has an appointment at the University of Waterloo School of Public Health and Health Systems, and he's a scientist with the Propel Center for Population Health Impact. And he migrated as a Canadian immigrant to Baltimore in 2013 and began his time with the Institute for Global Tobacco Control. He's done stand-up comedy, so he's a very entertaining colleague to work with. And today he's going to talk to us about the ban on Gutka in India. Yeah. And for those of you who don't know what Gutka is, Ryan will tell you, it has nothing to do with marijuana or drugs or anything like that, other than nicotine. Tobacco and nicotine. So Ryan, please enlighten us about the Gutka ban.
Oh, well, thank you very much, Steve. That was extensive. And it's true. I do thank you for that. It's probably more entertaining than some of my data crunching. So I thank you for that. I'm going to present some of our research findings from a study that we did in India looking at a series of policies that banned a tobacco product from the marketplace. The product is Gutka. This work was funded by our institute with monies from the Bloomberg Initiative, and it was co-funded by the World Health Organization, the India office. I'm going to talk today a little bit about smokeless tobacco use in India, Gutka as a product, the history and the development and implementation of those bans across the country, and describe a policy evaluation that we did in several states. I wanted to acknowledge our partners that worked on this together with us. We worked very closely with in-country, the World Health Organization, Ms. Vineet Gill-Munish and her colleagues. The data were collected by our partners at CCP. I wanted to highlight Dr. Sanjanti Velu and Dr. Pradeep Krishnat-Ray. Pradeep is actually based in India and was critical to the success of collecting our data. I want to highlight just for a moment, in tobacco control, we have a lot of levers, a lot of policies that we use to try and improve public health. We raise taxes, we apply warning labels, we restrict who can buy certain products and where they can be used. But the idea of banning a product, especially a product that has existed in the marketplace, is very uncommon. There are bans of smokeless tobacco products in places like Australia, but those bans were established before there was really a market there. Similarly, in Europe with snus products. We're going to talk today about Gutka, which had millions of users at the time that this was banned. There was some concern from the World Health Organization several years ago, not just in India, but worldwide, on an alarming trend of an increase in use of smokeless tobacco. And the WHO published basically a warning several years ago. They'd been tracking an increase in smokeless tobacco marketing, particularly towards youth, and acknowledging that smokeless tobacco use was quite high in certain regions of the world, including India. There's a bit of a sense that smokeless tobacco doesn't necessarily get the same attention that other tobacco products get. If you think about it, countries in the world don't have the same regulations or restrictions on health warning labels. A lot of smokeless tobacco doesn't have any warning label, let alone pictorial. So we were informed by some of that initial work. If we look at tobacco use in India, one of the things that's also interesting in this country is that the proportion of use is the largest proportion of tobacco use is smokeless products. So globally, if we look at most countries, if people are using tobacco products, it tends to be commercial cigarettes, but this is different in this jurisdiction. There's over a quarter of the population using smokeless tobacco, about 5% of dual users, so they're using combustible products as well as smokeless tobacco. If we look at data from the GATS, that's the Global Adult Tobacco Use Survey, these are from the 2010 cycle. We can look at some of the rates of prevalence of different types of smokeless tobacco. Kiny is the highest reported use, and you can see there's a difference between use between males and females. Another thing that's important to highlight in the Indian context is that smokeless tobacco is commonly used by women in this country and young girls. In a lot of jurisdictions like Sweden and even in America, if we think of smokeless tobacco use, it's primarily used by men. So what is Gutka? I have some packets here that I can pass around later if people want to see, but it's a chewable form of smokeless tobacco. It's prior to the bans, at any rate, it was widely available almost on every street corner. It's also a product that's largely socially acceptable to be used. And one of the things I think that's really important to understand in the context of its use is that it's a stimulant, and it's often used to stave off hunger or as a way to sort of get through hunger. If you're a young person in India working long hours and perhaps don't have access or time to eat, like this is one of those products that's sort of integrated into getting through the day. I wanted to share I talked briefly about some of the marketing. I wanted to show one of the ads, and so hopefully this works. This is for a pen. I have to stop it before something else starts. So you can see Gutka gives you magical powers and really excellent kite fighting skills. I actually, after I saw that, I kept thinking about Crouching Tiger, Hidden Dragon. If that had been a co-sponsor, I've thought of it actually a lot. I've thought about it. So, Gutka packets are not just marketed in ways that are very appealing and fun through media. The very packaging itself, it's bright, it's colorful, it's often flavored with really interesting. It's just appealing. It's often framed as a mouth freshener as well, and just ubiquitous prior to these restrictions that came into place. And of course, what's the big deal? The health burden from this product is tremendous. And we saw the prevalence and the proportion of the population using these products is of course associated with a range of health impacts, including cancers, but everything from reproductive disorders and low birth weight and cardiovascular problems. And it's really been the medical community that has taken leadership in this area to address this. And I think it's important to note that sort of coinciding with some of this increased marketing, some dentists and doctors were seeing lesions in young people as young as 10 or 9. They're seeing precancerous lesions. And there was really a groundswell from the medical community as well as the NGO community. What changed was that there was a federal policy change that, like a lot of countries like the US, tobacco products wasn't really a food, it wasn't really a medicine, so it fell into a regulatory quandary. The food laws were basically changed that said that if you're putting tobacco in with any food, that shouldn't be allowed. If it's going in, we need to regulate that as a food. And Gutka, because it has the spices and flavors, it was very clearly something that you were ingesting. And if you look at the EPI profiles, there's impacts on not just the mouth, but aspects of the other parts of the gastrointestinal system. So with this change in federal policy, it opened the door for states to start implementing their own legislation to address Gutka use. As you can imagine, the Gutka industry fought this, and a lot of their arguments are really interesting. Someone should do a content analysis on that because they started to frame, why would you ban this when you're not banning cigarettes? And so it was almost an internal tobacco, combustibles versus smokeless, which I think is funny because it sort of leads to, yeah, you're right, we probably should ban those as well. So, there were actions in the court, but ultimately we saw MP pass the first ban in March of 2012. And what happened then, those of us that were monitoring this was really exciting. You just saw within that single year, we had other 21 states pass similar laws, and by present day, we have almost every state and union territory banning Gutka. Now, what's interesting, and not to give too much away in terms of where we've landed in terms of impacts and evaluation, but we saw that what the industry did to respond was to begin to package the product differently. So instead of having a package that has your nicotine and your other constituents and flavorants mixed in together, they started selling twin packs. And in some cases, they rebranded them or reinvented them, but essentially we're working through a loophole in the legislation that still permitted a sale of a product, but it wasn't mixed in the same way, so people had to sort of manually mix it themselves. And so to go back to our research questions, as a research team here at Hopkins and working with partners in India, what happens? What happens when you do something like this? We had a set of research questions and a variety of methods to try and answer these. We first of all wanted to know, just at a very basic level, India is a huge country. What is the knowledge among people about the state level bans in the jurisdictions that they live? Do people support this kind of action? Politically, that's a really important thing to understand. If there is support from your populace, it's a lot easier to maintain a law like that. What has it done to the product? Did it go underground? Was it being sold? What happened to price, availability? And it's important to note that most of the bans that were implemented didn't ban use. It banned manufacturing, sale, distribution. So it wasn't a legal action against a user. It was more about a supply. What's been the impact on consumer use? Specifically, if people could no longer access Gutka, what products did they go to? Were they more likely to go to combustibles or other forms of smokeless? This is an important question to understand. And we're very interested in implementation. So there's a lot of challenges with a ban like this. The idea of retailers everywhere. And we had heard sort of from our on-the-ground partners that different states had done a better or not as good job in terms of implementing. So there was opportunities to sort of understand that. These are where we did study sites. There was an effort to have a geographic representation, so we didn't want to do it all in one part of the country. We also wanted to, as much as we could, be doing survey work and trying to understand this in parts of the country where use was higher. And we also wanted to do our studies in places where we thought there had been a range of implementation, sort of to round it out. And the methods. So we did a whole variety of efforts to collect data. We did observations at outlets. This sounds a little creepy, but we had people with discrete clipboards, I'm sure they blended, and they would sort of stand near retailers of other tobacco products. And they would stand there a couple times in the day, like the morning, afternoon, and just watch to see, did they witness anyone selling or purchasing Gutka products? We also did surveys across all the states of users. And for this, we included users that were still somehow sourcing Gutka, the blended packets. And the people that had switched to the twin packets, we still called them users because essentially we felt they're still using what they would consider a similar product. We found dual users, so people who had been using a smokeless Gutka product and something else. It could have been another smokeless or a combustible, bidis, cigarettes, largely. We also surveyed retailers, so people whose livelihood had been to sell Gutka and other products. And we had a big qualitative piece that I'm not going to give justice to today, but we did in-depth interviews largely to understand some of the things we couldn't explain from our quantitative data, and also to round out some of the implementation questions that we had. So I'm going to jump into some of the data. Does anyone have any questions at this point before we move into some of the numbers? Okay. So from our discrete people monitoring the outlets, we were able to observe over 400 outlets across the 7 states and the national capital area. And there was nothing observed of a sale while we were there. But there was evidence at each of those locations of Gutka packets on the ground. So people tend to buy the Gutka and use it immediately and then drop the. So there's some validity in terms of what the litter is telling us in terms of they're buying it. We didn't witness it. There could be a lot of reasons for that. Really discrete purchasing handoffs. We were able to get a little bit more information on that front by some of the key informant interviews as well. What was the awareness of the ban? This is, of course, from the survey data, and we did see a range. This is of users and dual users. We're getting in some jurisdictions as high as 100%, and some it's more like 25%. But the average across the country was quite high. Are you aware that there is a restriction? Mentioned politically, it's really advantageous to understand what support for these kinds of actions are. We asked from our surveys of the users, dual users, and the people that we identified who had quit using Gutka since the bans have been implemented. And it was, the support was quite high. It's 90 or 92% a cut. And these are, of people still using. Yeah. What did it do about the availability? Again, this is from our survey data. Most users were not able to find prepackaged, so they had switched to the twin packs. So they were still still purchasing, but in a way that was technically legal. About 16% were still able to purchase it, and that had come at a cost. The average price had increased greatly. I'm going to get to that in a moment. we were wondering, if it's harder to get, are you actually using less? And about half said, yeah, I'm using less. That's not validated by any sort of biomeasure or anything like that, but it's a curious sort of realization that for people that might be critical of these sorts of bans in terms of what it's doing, well, we know that at least there's been some sort of rejection by historic users. We found quitters. This was obviously hard to identify people who had reported quitting using Gutka products since their state had implemented a ban. And of those participants, we had a really high proportion in some states. Maharashtra was 88%. Of the quitters that we identified, they attributed their quit to the ban in their state. When some of these findings were released by the partners on the ground, the media was reporting that 88% of users quit outright, but that's not entirely accurate. It's of the people that we found who had quit, the majority were reporting that they had quit because of the ban. Really interesting in terms of, there's not a lot of research on how to support people that use smokeless to quit. There's not a lot of best practices. There's not even a large understanding about quitting patterns or interest. We found about half of the users and dual users had made a serious quit attempt to stop using Gutka in the last year. And the majority of them agreed that the ban would help people quit eventually. So one of the things that's important to understand about Gutka too is it's very affordable. Prior to these restrictions, people could buy a packet for half a rupee or a rupee. Since the ban, about 90% of our samples said that the cost had increased, either doubled or up to 5 rupees per pack. Support for policies to ban other smokeless tobacco. So, of course, I tried to frame up that this is a very unusual policy approach to ban a product that exists in the marketplace. What's India's appetite for going further, for banning additional products? We could see from one of the earlier slides that Gutka is only one of many common forms of smokeless tobacco. 90% of our participants agreed, yes, keep going, ban more. When we asked, do you agree that the state ban on Gutka is good for the health of the children of your state? Of course, one of the reasons that this was flagged initially was because there was a concern of an increased use among young people. And almost everyone agreed, yes, this is good. So it's politically, if it's framed that way, it's a very popular policy approach. We asked the retailers, we wanted to understand specifically how was the industry coaching them? What sort of product had they been trained to provide the customers with information about what other things they could try if they're not purchasing Gutka? These are interesting sort of findings. About a quarter of retailers reported that they believe Gutka is still being manufactured. In all of the states, the legislation says that manufacturing is not allowed. About a third of retailers believe Gutka is still available. With some retailers, we didn't ask them specifically if they were. Over a quarter reported that someone who had supplied them with Gutka had approached them to continue. And this was, of course, different across different states. Just quickly, with respect to some of the key informant interviews, we had over 60 interviews. And we interviewed people that were involved on the government side, so sort of policy development. Enforcement side, we talked to people who were enforcement officers, for example. And we also talked to NGO people who had been involved in either building support for the idea of the policy in their state, the implementation, and of course sort of a watchdog role as they rolled out. And so I'm just going to touch on some of the key findings. There was a real belief that if people didn't know about the health effects prior to these sorts of bans, that the implementation really raised awareness across. One person said, now it feels like people are eating cancer in a way. I think that's sort of an interesting visual. The support for the ban, this is from an enforcement officer that said people support the ban, and the kind of support I got was amazing, tremendous support. So there, I don't know if enforcement officers, that's a normal thing within tobacco control to feel that they're being supported by the populace. The product availability, people are still making it available for their best clients. We heard and read about sort of hand signals or sort of certain things that people would go to known vendors and that 15 or of our survey that's still able to get the blended single pack. How ubiquitous are the twin packs? Well, they're almost everywhere. We're getting reports that there had been some rebranding efforts. Cultural preference for Gutka. This is something that sort of rose. We didn't consider deeply in the design of the study, but we heard that this is like in other countries with cigarettes. There's a real sort of etiquette around Gutka and to be a good host and to offer. So this is a very sort of, and particularly in some parts of the country, a very deeply ingrained product into day-to-day. More a little bit on enforcement. We're trying to understand what's working, what's not working. And we got sort of different accounts of how things are being implemented. It was described the products being seized. The fines are very useful. In a lot of places, there's incremental fines, so it gets higher and higher the more that people are being found to be non-compliant. What's working well? The fact that it's harder to get the products and the products have gone up, that might not deter some people from using it, but what we learned was that they think it's actually being pretty effective for young people or for people that might have more difficulty purchasing in a marketplace. And so that's consistent with some of these objectives to protect young people from starting using this product. A little bit of smuggling issues, of course, regionally with some states that might border historic production areas or other countries. I mentioned this earlier too, the medical community and the civil society just being really important and critical in terms of lobbying for the development and enactment of these state-level policies and maintaining them, because a lot of them have to be renewed every year. So to make sure it's staying on the books. There was also a real good connection with there was some journalists that were real champions for this as well, and using their sort of ability to communicate and educate the different jurisdictions about the benefits of the laws. There's lots of limitations with what and how we did this. Obviously, we don't have our sampling frame was not representative. It only included adults, and of course, one of the priorities or rationales for this law is that it was oriented towards protecting children. So we're missing that perspective. And we didn't use any biomeasures. I mentioned that in terms of seeing if people had actually quit, for example. But if you take a step back, what we've learned from this is that support for the ban is high. It's quite high, and it's high across the jurisdictions we studied. And almost universal agreement that this kind of policy approach is good for the health of the children of the country. There is some evidence that even if people didn't quit altogether or continue to use that, they're reporting they're using it less. The twin packets is a challenge, and of course, since this, we've seen lots of states sort of implement new laws that are banning the twin packs too. I didn't get into that because it's outside the scope of this, but we have seen some legislative action in that area. Bans are associated with an increase in cost, sometimes fivefold. And of those that we surveyed that quit, they said that the ban actually was the reason that they quit. So we have lots of time for questions, and Steve, you can do more insightful. Julie?
What is in the non-tobacco packet that, why don't people just eat the tobacco?
Oh, okay. So yeah, it's like there's spices, there's areca nut, there are other constituents that actually just help. I mean, it's the flavor. Actually, chewing just raw tobacco it's not as pleasant. And I think there's a history of some of those constituents are chewed on their own, right? And so without tobacco, just on their own. So the tobacco is something that's sort of been added in because it obviously has an addictive quality and helps you sell more. So it's what we've heard from the respondents is that the twin packs are not as good. They don't like it as well as a product in terms of what they're getting and the use. But it's still good enough that. But it would be interesting to see sort of longer term how the loophole is it maintaining, or is it not satisfactory enough that it helps them quit? That's sort of a product regulation question.
So have you found beyond the shifting to the twin packs, for people who are not shifting to the twin packs, was there a movement towards, for people not,
I don't know if it's on, Steve.
for people not shifting to the twin packs, did you find that they were moving to either just the plain mouth freshener packets that the same companies produce, or they were shifting more towards things like cigarettes, which were giving them the tobacco that they desired? Was there a movement to either of those two?
Yeah, that's a really good question. That was one of our main quandaries. We found that the people that, the dual users did not shift more to combustibles. This is an important finding. We didn't, because that increases abuse liability, that increases potential public health burden. I don't know, we have reported brands that they've switched to, and so we have sort of 96 or something different products that people claim they're using. I haven't gone through it to specifically see, is that a product that's only a mouth freshener, or only the flavorants, not with the tobacco? It's most of the users that we identified, like 84%, were still using twin packs. So that's the majority of our market. So the dual users tended to reduce how much they were, but didn't necessarily increase how much they were smoking a day, either beaters or cigarettes. So.
Hello.
Oh, sorry, you have the mic.
So you told that those who were the retailers who were still selling tobacco products were actually using certain special code of communication to sale. So what was that code of communication?
I think we've got reports that they're doing things like they would come in and maybe tap the or do a hand signal. The people that we had doing the observations didn't witness this, or it wasn't apparent when they were doing it. And obviously, you'd have to be right beside them and if you were doing that from observational study, you're probably influencing behavior. So it's a flawed sort of approach that we took, but where we got that information was more from the key informants, from people that were doing enforcement, or people from the NGO community that are working with people on the ground. So the retailers didn't necessarily tell us that.
Because interpretation of those signs and signals could have introduced some bias in the study as well, because maybe the observer has some different interpretation of the thing.
Yeah, no, you're right. Had we done that, but our finding that people are using hand signals came from our interviews. So it wasn't, I think that when they were doing the retailer observations, they tried to look for that, but they didn't see it. And so it's, we would have to be really cautious in saying that we know exactly what they're doing. And it's probably different for every retailer and consumer, right? So it's, yeah.
Did you conduct any of the observational studies or interviews in the 2 states that don't have bans in place?
No, we didn't. No, that's a good, that's another limitation to the study. I'd have to remember, but I think the part of the rationale for the states we chose was we wanted high use, and so they wouldn't necessarily help in our design as a control because there's variance across different states anyway, and so and brands would be different too. Like we could have used that in our overall methods, but it wouldn't necessarily accomplish what you traditionally want for the reason to include them. So
do you know why those 2 states don't have bans in place? Like where is the
what's the holdup?
Yeah.
Yeah, I don't know. It's one's a union territory and one's a state. Yeah, yeah. So reading the decision of the federal government, it seems like they have to. So it's almost like those jurisdictions are not compliant with a federal, so they should. So it could be political will. It could be other things going on. I don't know. It'd be wrong of me to guess. So.
Okay, you have to get very close to the microphone.
I'm pretty loud.
Okay.
Ryan, can you go back to that slide where you had different products? It was one of your initial slides. There are
right,
smokeless tobacco products.
The Kaini and...
Yeah, right.
Right.
Was that with regard to the percentage of use?
Mm-hmm.
Like what product is used?
Yeah. Sorry. We're getting there.
Maybe second, third or something.
We could watch the video again.
Okay.
Yeah.
Okay. So what are you trying to show there?
So those are GATS data from the 2010 cycle, and that's overall smokeless tobacco use reported by gender for the three common smokeless tobacco uses, and then the others are just lumped together.
Right.
So my purpose for this was to demonstrate that women use smokeless tobacco at rates that might be higher than other jurisdictions.
So what was very interesting in this study, which came out in Lancet, it's related to that 1 million death study, and that's the PI with whom we are working in Tata Memorial.
Right.
And they're showing oral is the #1 cancer for mortality in men, and it nowhere factors in the top 3 for women.
For women, yeah.
So you seem to show that they are using quite a bit of betel quid, and I think I always used to think betel quid is the more carcinogenic part of
Yeah.
this whole Gutka business, along with the calcium, right?
I would guess that, yeah.
So,
Yeah, that's
any
curious.
comments on that?
Are there differences in rates of treatment in India? Would people have different, if it's reported hospital rates, would there be a reason that men are getting more treatment than women? Or
They showed that rural has twice likelihood of dying out of cancer than the urban, something like that. In that
Okay.
But nothing on that part.
yeah, I think rural rates are higher for women. Yeah, so that might be a piece of it. So, like product variants might be. No, obviously these different products are going to have different carcinogenic effects, and so the other category there, that's a whole range of products. I think we said there's almost 20 common products for smokeless.
So the first product is the most widely used product, and
Yeah.
there's no way to stop that, right?
Yeah,
But that you can make it in your hand.
Yeah, my understanding is that the Kaini product that's the most reported used product in the GATT survey, because it's just the lime and tobacco,
Right.
so it doesn't have the same ingredients that Gutka would, which classifies it as a food. So it's curious. Yeah, if you look at that, you think, well, why did you ban Gutka and not the most common one, or why didn't you ban both of them? So, but as jurisdictions have expanded their laws to capture other smokeless tobacco, I think this is being captured in some places. It's that's
Okay.
yeah.
Congratulations, very nice study. I was in Mumbai that day. This was in Times of India, and we were having the meeting in Tata. Everybody knew the school for this report, so that
Yeah.
was great. Thank you.
It was millions at a time. Yeah.
I just wanted to add to this slide that the purpose of this slide is to more illustrate that the use of smokeless tobacco by women is comparatively more than their use of cigarettes and bidi. So that's why it might add to your answer that why we have shown women using more, and despite their the rate of cancer being lower as compared to men. So
But we've got almost 20% of females, and for the GATS it's 15 and up too. So, so that probably captures. I mean, the GATS, when they report age of initiation, it's around 18. But of course, GATS isn't a perfect methodology either, right? In terms of we're probably missing a lot of.
So stomach is #2 cancer for men and women both, and cervical is #1 for women, and the third one is breast cancer. So that's
Right.
what they show. So the Tata people were saying that stomach could be influenced by smokeless tobacco.
Yeah.
Some of it goes into your stomach. And
Yeah,
it's
I
so
think-
unique in Indian diet that stomach cancer is #2 for men and women.
Yeah, we've gastrointestinal stromal tumors. Yeah, we've, and it's consistent with the idea it's a food, right? You're sort of impacting other. Yeah, I think it's a curious thing in terms of communicating the risk to it, because I think a lot of smokeless tobacco in India, there's been a real focus on oral cancers. And we know from studying health warning labels that some of the highest recall and most salient images are impacts on the tongue and mouth,
Right.
and it's really visceral. Like a stomach cancer is obviously going to deeply impact your quality of life and possibly kill you as well, but it's harder to demonstrate, it's harder to show, right? It's a very visual representation. And there's really effective social marketing that took place in India, especially highlighting young people that have lost, have been disfigured from cancers caused by smokeless tobacco use. and it's just, yeah, it's really visceral, I think, and there's certain impacts from tobacco use that, like COPD, that are horrible, but it's harder to communicate. Things like oral cancers have the advantage of being very salient to us. So,
yeah. Just a quick question on data collection. So,
Yeah.
For the purposes of redesigning the study, you sort of talked about how most of the data was self-reported, right?
Right.
So, in the future, if you were to redesign this, then would you have any non-invasive methods of sort of validating that data? Like you talked about the biomeasures. Are there any non-invasive methods of doing that?
Yeah, you can't do CO. So it's like, I'm not as familiar with reported tobacco use validation, but certainly we know from tobacco use that there's been a lot of studies to see how close are people or how accurate are people. So I don't know how important it is to get biomeasures for some of these things. And especially considering that Gutka and other smokeless is socially acceptable, or was, it's the denormalization is taking place right now. So to redesign it, I think I would probably more likely focus on participant selection as opposed to refocus on validating accuracy with their reports. So I think, does that make sense? Yeah. Okay.
Just to follow up on the survey part, I just want to know how were the 400 vendors selected, and a little more about the methods of who and where, because I don't know if you remember this, but Rajiv presented on the smoking ban signs,
Mm-hmm.
and there was a sampling strategy, and I was trying to...
For the cup, yeah. So we tried to mimic, that was a premise for our sampling. It was, I can send you the specific details for how they ended up doing it, but the idea was to go into a retail environment and do a walking protocol and then identify, and some of it came down to you had to go somewhere where there was a sight line. So, which, of course, to do an accurate, and it had to be somewhere that people might be standing somewhere for an hour and a half. So I think it was close to bus stations and things like that. So, so again, and there was a mix of, it was harder in the rural setting. Like we did a sort of stratified urban-rural, and the, yeah, there was some challenge in that, just to sort of sufficiently identify. So I think in some states we actually oversampled in some of the urban. So, but if that's something that's curious, it was purposeful, and there were requirements for where we were doing the sampling that would enable the most accurate data collection. But again, it's not. It wasn't representative. The thing about this, of course, is that vendors, there's not a list of vendors. If you want to do this in Baltimore, you can go to the city hall and get a list of licensed tobacco vendors. In India, there's people that sell carts. They're mobile. They're mostly there every day, but they might not be. So there's a lot of sort of different considerations when you design something like this. So there was a mix of sort of bricks and mortar. There was a mix of sort of mobile carts. Again, but the data collectors were instructed to be as discreet as they could be to try and get as accurate as they could get. So, yeah.
Well, although you think
it's
this
for
is
the
not
recording,
working,
Jolene.
it's good for the recording, because that
So you can appear on the
picks up
internet.
you'll be famous on Facebook.
You all signed the waiver, didn't you?
Ryan, how do they sort of market the ban in each state?
Pardon me?
How did they market the ban? How
Like
did
promote
they-
the ban?
Yeah.
So it would have been different in different states, but by and large, there's a sort of partners on the ground that were. India has a really active civil society layer, so there would have been. It's sort of the combination of the media letting people know, enforcement officers. Sort of, in some jurisdictions, letting retailers know. Yeah, and then the retailers would have to explain to the customers that, it's no longer legal to manufacture, distribute, or sell Gutka. So, but yeah, I think it's overwhelming for us to understand, because these are millions and millions of potential retailers, and in a really huge geographic area, and lots of challenges. And so it's a real testament that, these were rolled out, and as quickly as they were. So.
I guess I just wanted you to talk a little bit more about the enforcement, because you had mentioned that there was no ban on consumption, but just on the distribution. And so I think you also mentioned that it went up incrementally, like if it was your first offense, maybe it was, I don't know, 2 rupee or something, but how did it go up and how is it actually enforced, especially if the people who are distributing and selling,
Right.
they're not always in the same place?
Yeah, they're not always, they don't have a number, and yeah, there's obviously specific challenges with some of the retail sort of settings, but Harkrat, I don't know if you have more insight from Harkrat did all the qualitative data coding, so he would be more familiar with the insights from the enforcement officers. But I think there's a lot of variation state to state. And like we said, we sort of picked states that we knew were doing more activity for enforcement and less. So what we've been, I'll let you respond in a moment, Harkrat, but what we've been interested in is sort of in the jurisdictions that had a really comprehensive implementation, how did they do that? What did that look like? What sort of trainings were necessary up front? What materials were, things like signage? How much lead time do they need? How do they manage fining and subsequent findings? These are things that we're trying to figure out, and sort of not just for India, but for other jurisdictions that want to implement similar. Harkrat, do you have any sort of added insights? I know you just got off a bus from Toronto, but.
So I think from the interviews especially, we came to know that the political backing, like the law which was enforced, that especially helped to restrict the manufacture of the product, and then like restricting the manufacturing of the product, and then the product was not available in the market. So that really helped in the enforcement. And secondly, I would like what I felt from the listening from the interviews was that the social media and like NGOs, they were really helpful in creating a environment that would support the ban. So I think it's a mix of political backing and social environment that really helped in the enforcement.
Mm-hmm.
And and even from the interviews, these two were the main factors that helped in implementation.